This topic is child mistreatment. Child mistreatment includes abuse and neglect. Abuse, by definition, is the intent to cause harm to a child. This harm can be done physically, emotionally, or sexually. Neglect, which is the most common form of child maltreatment, is the caregiver's lack of ability to provide basic needs or adequate level of care for a child. We can break this down into two different categories. Physical neglect is the deprivation of basic needs such as shelter, clothing, or food, as well as the deprivation of supervision, medical attention, or education. Emotional neglect is the lack or failure of a caregiver to provide the basic emotional needs for a child. This can actually hinder their development. So let's discuss some of the risk factors for child abuse and neglect. Caregiver background is very important. If the caregiver themselves have a history of abuse, then they are more likely to be a child abuser. Caregivers who are single parents or very young parents are at higher risk. Caregivers with a history of any psychiatric disorders or substance abuse disorders are also at higher risk. Children and families with a lack of social support, including decreased financial abilities or support, are going to be at higher risk as well. These families have a limited amount of resources to take care of the child, and this is what typically leads into the child mistreatment. Unsafe or unstable home environments, which include families who are going through divorce or high conflict, families who are experiencing domestic violence, children with disabilities, or children who are a product of unwanted or unplanned pregnancies are at a very high risk of child abuse. It's important to highlight that children with disabilities may be nonverbal and will not be able to communicate or even report child abuse, which is why they can be at higher risk. So let's discuss the clinical features of abuse. Now, we're first going to talk about kind of the demonstration or relationship between a child and the caregiver. If a child presents with an injury, it's important to intake the history of that injury. So we may see in a child abuse situation that the caregiver gives very vague details or changes the story often. There's no consistency in the story. We may also see an inconsistency in the injury based on the developmental age of the child, or even an inconsistency with the mechanism of injury. So for example, if a 6-month-old child presents with a femur fracture and the parents state that the child jumped off the bed and broke their leg, that's inconsistent with their capabilities of their developmental age. This should raise a red flag. It's also suspicious if the parent or caregiver is blaming the sibling for the injury. Caregiver behavior, and again, that interaction between child and caregiver, is very important to note and to watch. If the caregiver becomes very argumentative, violent, or even very defensive during this time of reporting this injury or questioning, that can be concerning. Lack of emotional interaction with the child. Typically, we will see that parents will be empathetic and trying to console their child, or may even feel a little bit guilty if they've been injured. Caregivers in a child abuse situation may seem more detached or actually more aggressively angry or blaming the child in this case. This again leads into this inappropriate response to the child's injury. Their caregiver may be overly angry or aggressive, or they may be completely detached and not seem as if they're very empathetic towards this injury. A delay in seeking medical care from an injury is also concerning. So if the child has had this relatively severe injury for over a week and they're just now seeking care, that can be concerning. So now let's talk about more of the physical features that you'll see on your assessment with a child who's a victim of child abuse. As you can see in this illustration, injuries can occur anywhere on the body and can range from mild to severe. Multiple fractures in multiple stages of healing is extremely concerning. Spiral fractures in particular have a high incidence of child abuse, as this fracture is from an outside twisting force. For example, if the caregiver takes the child's arm and is twisting it, that will cause this spiral type of fracture. Likely inflicted injuries that have demarcations of specific objects, such as a cigarette burn or a burn that is consistent with an iron. Linear immersion burns, as you can see in our illustration, are also extremely concerning. These children have been dipped into boiling hot water, and that will show on assessment with a completely linear burn on both extremities. Long bone fractures are some of the harder bones to break and take a larger or heavier force. An example of some long bones are the femur or the humerus. Bruising in multiple places on the body or in multiple stages of healing are also very concerning for child abuse. Some strange places you may see bruising in a child abuse victim would be on the buttocks, the trunk, or even on the ear. Injury to genitalia, back, buttocks, or hands is also concerning. Most of these places, excluding the hands, are easy injuries to hide or disguise. And injuries on the hands can be easily justified, saying a kid is just a kid and they've knocked their hand or they fell. The apprehension or fear of a child from their caregiver is also a red flag and can be alarming. If children are seeming very withdrawn or very fearful of any reaction from their caregiver, we need to take note of this. A caregiver is supposed to be the comforting person when a child is hurt or injured, and if they seem more withdrawn or even overly aggressive or fearful, we need to make sure that we're monitoring this and keeping an eye to see if we need to report this. Another form of child abuse is shaken baby syndrome. This is an abusive head trauma, and this typically occurs in infants or newborns. As you can see in our illustration, the infant or newborn is held and shaken aggressively. This causes damage to the brain due to the coup-counter-coup movement. That just means the brain is aggressively shaken within the skull and causes injury. This can lead to subdural and epidural hematomas and bleeds, as well as retinal hemorrhages, as you can see in the illustration. Shaken baby syndrome can be very difficult to actually diagnose upon assessment because we see very little evidence, if any evidence, of trauma when we look at the child. The only thing we may see on assessment is some small bruising at the area that the child was held during the incident, so that may be around the trunk or even the arms. It's important that we understand the symptoms of shaken baby syndrome. These symptoms can include the caregiver stating that the child is extremely lethargic or listless. The child may be vomiting, or they're not wanting to eat as they normally do. Or the caregiver may even say the child is inconsolable and will not stop crying. Bulging fontanelles are also a concerning sign and can be consistent with shaken baby syndrome. This is due to that cerebral edema that can occur after the brain is injured. A large head circumference can also be seen upon assessment, again, due to that swelling. And don't forget to always look for retinal hemorrhages if you are concerned for shaken baby syndrome. So now let's talk about sexual abuse. Physical signs that we might see on our assessment of sexual abuse are difficulty or pain while sitting or walking, as well as torn, stained, or even bloody underwear or underclothing. If the client's complaining of pain, swelling, itching, even a discharge or foul odor from the vagina or penis, this is also concerning. Bruising, bleeding, or lacerations in any of the orifices, such as our mouth, the genital area, or the anal area. Injuries can occur in these areas, but again, if we're taking in the history of the injury and it's inconsistent or vague, we need to make sure that we take note of that and maybe become a little bit more concerned for possible sexual abuse. If the child tests positive for an STI, or if a young adolescent is pregnant, we need to keep this at the forefront of our minds. Now we've discussed all the clinical features and signs of child abuse. Let's talk about child neglect. Again, this is the lack of basic needs being met, whether it be medical attention, food, shelter, or even education. So when clients that are experiencing child neglect, we may see poor hygiene. They're not given clean clothes. They're not being bathed regularly. These clients will be persistently hungry. They may not be fed regularly or enough. We may also see signs of malnutrition, which includes poor weight gain. Children should consistently be gaining weight throughout their younger childhood, and if they stay at the same weight or start to lose weight consistently, that's concerning. These children will also have thin extremities and a small amount of subcutaneous fat. Evidence of poor health care. These clients are not following up with their pediatricians or seeing their pediatricians regularly for their annual exam, even not seeing their dentist, so we need to see how their dental hygiene is. Frequent absences from school or truancy is very concerning, and especially if the client doesn't have any reports of being sick frequently. And reports of lack of supervision. This typically is from outsiders who are able to see that the child is left home alone at way too early of an age or is unsupervised while outside. So if we have any suspicion of child abuse or child neglect, we need to report this. Remember, as nurses, we are mandatory reporters. So in reporting this issue, we do need to have an interview with the caregiver as well as the child, but this needs to be done separately. So we do need to pull the child alone away from the caregiver so that we can hopefully get some honest and true answers about what's going on in the home. We do need to be direct and honest in our approach towards the child and the questions that we may have for them. We need to be honest about our reporting requirements and keep the child in the loop of what exactly we want to know and what exactly we're going to do to keep them safe. Reminding them that we're doing this for their safety and not to get them in trouble is extremely important. Ask open-ended questions. We want to get as much information as we can out of the child, and so we don't want to ask just yes or no questions. We need to avoid leading questions that may cause some prompting of some of the answers we suspect or are wanting to get in return. Allowing the child to disclose this information at their own pace and time frame is extremely important as well. Remember, this can be traumatic to run through some of these abusive interactions they've had with their caregivers, so we need to be patient with these kids as they're trying to elicit the experience they've had at home. Avoid making assumptions and also try not to have any type of response. If you start to hear these pretty traumatic or disturbing incidences, We need to make sure that we're not showing any signs of anger or blame, as well as any signs of shock or disapproval. Again, we want to be honest with the child and we want them to feel safe to be able to relay this information to us. We also need to monitor the child's affect while they're discussing and reliving these traumatic events with us. It can be concerning if the child doesn't seem disturbed or emotional while talking through these traumatic events. If the child seems happy while discussing a kind of disturbing event, this is concerning. And making sure again that we are reassuring the child that we're doing this for their safety and that they're not going to get in trouble. We want them to feel safe so that they can report to us. So let's discuss how we can intervene in a possible or suspected child abuse or neglect situation. Remember, we are mandatory reporters, so if you ever suspect there's child abuse or neglect, we need to report this to the local authorities. If there's concern or suspicion for sexual abuse, a SANE nurse needs to do a physical assessment and also take a verbatim statement from the victim. A SANE nurse is a sexual assault nurse examiner. This is a very specific type of nurse, and they may not be available at every healthcare provider's location. So if they are available, we do need to use their expertise. The SANE nurse will also, upon their physical assessment, have a body map where they will list any type of injuries. With taking the client's or victim's statement, they also need to state the last time of abuse or injury. And this is all to help for forensic evaluation. And don't ever forget that this is a child that has been in harm and is not well taken care of. So we need to remember to provide that emotional support for these children, which may look different for each child, but we need to do our best to make them feel safe.